नमस्कार, मैं आरजे प्रवीण और अच्छी खबरों और सच्ची खबरों को देखने के लिए न्यूज़ टुडे पर अपनी आंखें बनाए रखें। थैंक यू।
Next patient who comes onto this bed may not respond to that antibiotic. Leaving aside so many other collateral damages that are more technical in nature, which I may not speak about. But what I'm probably harming is the next patient who is to come onto the same bed, he may not respond to the same antibiotic that the first patient did. And you media, because I don't know, because of sudden increase in nation pride, they take a lot of flack when a study like Lancet study is published, which says that the water supply of Delhi contains very serious bacteria which do not respond to commonly used antimicrobials, commonly used antibiotics. And this has been shown and published. And they took it as an umbrage that a very resistant mechanism of a mechanism of resistance which is new and novel has been named as New Delhi metallo-beta-lactamase, as though New Delhi had contributed to that resistance.
First, and is what is called a One Health concept. I think it's important for you to disseminate this. It's not only the use of antibiotics by the doctors to the patient, but the use of antibiotics in agriculture. You see, antibiotic sprays are being done in agriculture, in farm houses, so that the plants are not destroyed by the different kind of bugs. Same with the animal husbandry. You see, antibiotics are used in poultries and many other animal husbandry as a growth promoter. And as you know, there are many industry factories manufacturing drugs. The effluent of those factories go into the rivers, and they also have antibiotic residuals. So this is called One Health concept. The food that we are eating has antibiotic. You see, a person who has never been exposed to an antibiotic, it has been found they can get an infection due to an antibiotic resistance. So how can he get an infection due to antibiotic? He has not taken antibiotic. So even young kids, I remember a young kid has come, a 13-year-old, never had antibiotic in his life with appendicitis, and his infection was due to a drug-resistant infection. So it must be the antibiotic that he has consumed in a food has given rise to resistance. And how did he got that antibiotic? That must have been used while manufacturing the food products. So I think that is what is called One Health concept. We can't keep it in isolation, just prescription of antibiotic. And second, not only outpatient, inpatient, but as a whole antibiotic prescription. So that is one thing which needs to be looked into and needs to be disseminated, this knowledge. Herpes vaccine. So if the masses get vaccinated, then the chance of infections will become less, and automatically the antibiotics will become less prescribed. So these are the two things I think needs to be highlighted as well in media. So I will hand it over to Dr. Sanjeev for his views now.
This is what has occurred. It's to get off anxiety of the doctor, maybe anxiety of the patient's relatives, and especially in pediatrics. She was discussing that when a child comes to the clinic, to an outpatient clinic, it becomes the parents do ask, why have you not prescribed an antibiotic? Now that is a fear, and the doctor also does not have this. Partly, I would say the doctor also should have the patients to discuss the entire case and take that element of risk. So as time goes, we are going to get better. As point of care diagnosis, जिसको बोलते हैं, in that place itself, if you can diagnose it's a viral illness, then maybe we can curb this prescription of antibiotics. See, remember this a while ago, where there was no antibiotics, people were dying. Now we have millions of antibiotics and still no people are dying. So this has occurred because we have gone back to that condition where even if I fall on the ground and I have a scratch on my knee, I will probably require a very, very heavy dose of antibiotic. This is what is occurring as of now, and I'm shudder with that view that we will have nothing to save people. We will have nothing to save people as time goes.
Have any antibiotics before 1940 when Alexander Fleming first identified penicillin. After that, we have enough antibiotic, one after another, and it's just like water everywhere in the sea, but not a drop of water to drink. So we are going to have a situation where everywhere antibiotic, but there is no antibiotic is going to work. So we'll go back to pre-antibiotic era. The things are going in that way, unless we, the stakeholders, and that includes, Dr. Subha has mentioned that not the doctor only, everyone has got responsibility, including Dr. Subha's Todi has highlighted that livestock, whatever is given to the animal, that could be the source of resistant antibiotic. So you have to have some clinical background, what could be the organism, even the most cheapest antibiotic, say for scrap typhus, we are getting scrap typhus with sepsis. Just doxycycline is a cheaper one, can cure, but we are giving meropenem, colistin and whatever. And that will cause what Dr. Sastry said, environment. The environment you will have a land up with colistin resistant, meropenem resistant in your unit, and subsequently one patient needs that, and then it's not going to work. So it's everyone has to be very careful in choosing antibiotic, writing antibiotic, duration of antibiotic, dose, and dose has to be given in proper way, applying PKPD principle, that's the technical part. But what we are using, we have to be careful in every areas if you want to save antibiotic. Otherwise, we'll have everywhere water, nothing to drink.
And he talked about livestock, other things. So we have to look at the new concept which people are talking about, and we need to talk to the people, is the One Health. My health is dependent on you. You all saw in the COVID that if one person is not well, we'll be able to have the spread. Same thing, we have animals at home, pets at home, other places at home. It's not only, there's also multiple things are there. So अगर आपको antibiotic resistance को देखना है today, the problem is that it's not only doctors, it's not only veterinarians, it's not only people in the poultry. We also have to have a behavior which is conducive with personal health as well as the public health. I think it's a public health message. It is not that simply it is critical care. This message has to go up. अगर हमको अपनी next generation को, as my colleagues, friends have talked about, देखना है कि the privileges which we had, it, longevity we have got, the modern medicine, the biggest gain, if we have to have it, we need to preserve it. And please realize that the data I am giving, and Dr. Todi and my colleagues will give it, upper respiratory infections, that is the flu, or let's say your other infections, 66% data shows are overused in these cases where there is no need of it. Flu, majority of the time, is caused by the viruses. So what you need is, you need to treat them with antiviral, documented if it is there. So what we are doing is, you just pop a pill. So it's not like that I take a pop a pill and suddenly I become a jumbo and I can keep on fighting. No. So that message you have to give, please don't take it. You are creating trouble for yourself, you are creating a trouble for your family, you are creating a trouble for the society. So that is one part. Second part, medical professionals के अंदर भी, they have to act responsibly. They should know what is happening in the area. One of the classical examples, typhus, everybody talking about today. 50 रुपए में आपका इलाज हो जाएगा जो हम 5000 में करते हैं. क्या वो justified है? नहीं. Finally, इन्हीं चीजों को करते हुए कुछ एक आज के दिन, जैसे डॉक्टर सुब्रमण्यम बैठे हमारे आईडी एक्सपर्ट हैं, we should take the support of the labs also. We need to cross talk also as a medical profession to other professions, so that, and media has a part of health communication. Proper message percolate उनकी local language में जाना बहुत जरूरी है. Like आप लोग यहाँ से तो बांग्ला में जाए, अंग्रेजी में भी जाए. And similarly, a lot of people are coming to us when we are talking in terms of antibiotic resistance, etc. कि सब best दवाई दीजिए. Best दवाई आपके लिए वो है जो महंगी नहीं है. Best दवाई वो है, जैसे डॉक्टर साहब ने बताया, जो आपका उसके लिए सेंसिटिविटी है. तो हमें लैब के साथ करना पड़ता है, लेकिन जो हम लोग सीरियस पेशेंट में अंदाजे के साथ जो आईसीयू में काम करते थे, वो प्रैक्टिकली नॉट होता जा रहा है बिकॉज ऑफ द मिसएडवेंचर्स. आई वुड लाइक टू यूज द स्ट्रॉन्ग वर्ड आई एम यूजिंग एट डिफरेंट लेवल्स. देयरफॉर आपके माध्यम से मैं सरकार से भी अपील करना चाहूँगा कि जैसे हम आज के दिन कोई सेडेटिव्स या कोई जो मसल वीकनेस की दवाई देते हैं वो बगैर प्रिस्क्रिप्शन के नहीं होती है, इसी तरह से एंटीबायोटिक्स के अंदर बिसाइड रिस्पॉन्सिबिलिटी ऑफ द मेडिकल प्रोफेशन, वेटनेरियंस एंड ऑल्सो पब्लिक हेल्थ, देयर शुड बी मैंडेटरी गाइडलाइन कि नो एंटीबायोटिक लाइक केरला गवर्नमेंट हैज डन इट विल बी गिवन विदाउट रिटन प्रिस्क्रिप्शन। इसी तरह से जब ये एंटीबायोटिक का जो ओवर द काउंटर यूज है इसको हमको बंद करना होगा। Besides that, this is my मोटा message, so that all of us to work for the benefit of the society in the interest that our next generation, हमारे बच्चों को, हमारे उनकी generation के बच्चों को उसका फायदा मिलता है। Thank you.
Ending up in a situation where I said that water everywhere, but not a drop of water to drink. Similarly, antibiotic, you will have lots of antibiotic, but all are resistant unless you don't abuse antibiotic. I'm just using that word. We are abusing antibiotic, not only misusing. So this is very important. Just I'll give you one example. During COVID time, if you take the data from all the hospitals, pharmacy, usage of antibiotic was much less, in spite of having so many patients, because we knew that this is viral infection, we don't need antibiotic, we are given steroid, but we have been misusing or abusing antifungal, and that too in certain part of our country. And what result they did have? Excessive fungal infection resistant. Similarly, this is a eye opener. We have to be very careful about using or choosing antibiotic. It's very important. Unless we give, I would say that most important part of any hospital is to audit how much antibiotics are being used for last 1 month, what are the antibiotics being used, and what was our surveillance data of bacteria. If I can match that, then probably we'll okay. If we can't match that, and if we find that we are using this antibiotic such a volume and our resistant pattern is like that, one has to be very careful from the administrative side, hospital administrator.
तो हम यहाँ हैं क्योंकि एंटीबायोटिक स्टूवर्डशिप के बारे में बात करने के लिए। अभी जो कीड़ा जो बन रहे हैं, जो एंटीबायोटिक्स उनके ऊपर काम नहीं कर रहा है, और अभी जो इन्फेक्शन जो हो रहा है उसके कारण पेशेंट को बहुत दिक्कत हो रहा है, इसमें कॉस्ट बहुत ज़्यादा हो रहा है और ज़िंदगी का रिस्क भी बहुत ज़्यादा हो रहा है। ऐसे हालत में ऐसा हो जाएगा कि कीड़ा जो बन जाएंगे वो कोई काम नहीं होगा, कोई एंटीबायोटिक लेंगे भी तो कुछ फ़ायदा नहीं होगा। तो इसके लिए क्या करना है वही हमें सोचना है। हम तो ये बताते हैं, इफ़ अ चाइल्ड प्लेस विद अ टॉय फॉर वेरी लॉन्ग द चाइल्ड विल ब्रेक द टॉय। वैसा ही है, हम ज़्यादा यूज़ करेंगे तो वो बिल्कुल टूट जाएगा। तो ये यूसेज कम कैसे कर सकते हैं विदाउट लूजिंग सेफ्टी, वही हमें देखना है। वही एंटीमाइक्रोबियल स्टूवर्डशिप का बात है। और फिलहाल इसमें सब लोग को एक साथ काम करना पड़ेगा, यानी कि जो प्लांट इंडस्ट्री में है, फिशर इंडस्ट्री में है, जो एनिमल हस्बेंड्री इंडस्ट्री में है, फार्मेसी में है, और पार्टनर्स इन द फार्मा इंडस्ट्री, मीडिया इंडस्ट्री, गवर्नमेंट, मेडिकल सर्विसेज, नर्सिंग, एवरीबडी, हम सब लोग को एक साथ काम करके इस सिचुएशन को निपटना है, वरना इट विल बिकम वेरी एक्सपेंसिव एंड वेरी डेंजरस। थैंक यू। मेरा नाम सुब्रमण्यन स्वामीनाथन।